counties are key to fighting COVID and to provision of healthcare. And let me say this clearly. We have seen a move by people who want to take healthcare back to the national government. Before counties were formed, healthcare was in shambles. Hospitals were smelling. People were dying left, right, and center. There were no ambulances. Here in Machakos, for example, when I got in, we used to have only 6 ambulances and 4 on top of rocks and 2 did not have fuel. Now in every administrative location in Machakos 75, there's an ambulance. And it's the same story in all counties. And so, as a result of health being devolved, we have hired more health workers and we are able to manage them to ensure that they are there, they are working, they're not putting on a jacket and going to their clinics. We have cleaner and better hospitals. We have improved infrastructure. Look at go to Kakamega and see the level 6 style of hospital that is doing there. Go to Kisii. I went to Isiolo the other day. I was shocked by the work that has been done in Isiolo. Go to Kajiando. Look at the work that the governor is doing in healthcare. We are able to manage our issues and any outbreaks better from here because even our community health workers, they relate with us, they can go all the way to the village and we can manage epidemics. The reason some people want to take healthcare back to the national government has nothing to do with provision of healthcare. Hapana, ni kwa sababu development partners are now funding facilities directly. They are funding counties directly because development partners have realized the money is better used when it is channeled to counties and not going through the national government. The national government, there are some people who still think of it as central government. And you know how it operates in Afya House. For many years, cartels have formed, and now they are missing. All this money used to be used for things like funding political games, getting into people's pockets, pharmaceutical wars, cartels in Afya House. So as a result of that, they want the money back. It is all about corruption. So wananchi, wakati mnasikia ati healthcare irudi national government, ni kwa sababu wanataka kula. Hawajali kuhusu mwananchi atakufa, hawajali kuhusu daktari anatibu, hawajali maslahi ya wafanyikazi, wanataka kula pesa ya mwananchi. Tutanyonywa mpaka lini wa Kenya? Tutanyonywa mpaka lini? Tumenyonywa. Sasa tumeisha kabisa, hata pumzi ndio inatoka kwa damu yetu, kwa mifupa, kwa mifupa na kwa mwili wetu. Kwa hivyo tujue ya kwamba any attempt to take back healthcare to the national government will be basically finishing Kenya. We'll go back to 1960s. It will be a tragedy. Na naomba wananchi wote katika nchi yetu ya Kenya tupinge ufisadi na tupinge ukora wa kusema mambo irudi pale center. Mtu ambaye hajafika Machakos, hajafika Nguluni, hajafika Shamahoho, hajafika Oloitoktok, mtu ambaye hajafika kule Isiolo katikati, ati yeye amekaa Afya House ndio anaamua vile mambo yataendelea huko kwa hiyo dispensary ndogo. Haiwezekani. We have to have the ability to do mass testing. We are very happy that Machakos level 5 is one of the COVID-19 testing centers. And we welcome people to come and be tested. Right now, because we don't have enough testing kits, we concentrate on the ones that are in danger. But even the ones that are interacting should be tested. I have been tested, Mr. Chairman, and I'm okay. Yes. And if you want to be tested, if any of the governors want to be tested, you can be tested. I would encourage you to get your driver, bodyguards tested because they are with you in the car all the time. And the mask can only do so much because we can't have a governor put in isolation at this time when we need them to deal with the floods and other things. So we've been tested here in Machakos and we welcome you to be tested even now if you wish. Ugonjwa bado upo na tujichunge, tusianze kulegea. Unajua unaweza fikia mahali tuanze kufikiria kwamba mambo ni sawa, lakini lazima ugonjwa huu tupigane nao. Ni ugonjwa sumu kabisa. Ulimwengu mzima umeacha kufanya kazi, shule zimefungwa ulimwengu mzima, ndege hazipai kwa sababu ugonjwa huu uko kwa hewa hatuuoni. Kwa hivyo mambo ya kuvaa mask, mambo ya kukaa kando na wengine, tusianze kufikiria kwamba umeisha. Kwa hivyo tujikinge kabisa. And we are very lucky we have devolution now ya kwamba mambo haya tunafanya contact tracing yanafanyika vizuri katika county kwa sababu kuna serikali za county ambazo zinashirikiana.
will be to put an emphasis on a critical point on our international borders. As you are aware, we have huge international borders, one being our border with Tanzania, where Kajiando stretches almost 80% of the border, and watching the situation unfolding in Tanzania send cold shivers to the people of Kajiando and Kenyans in general, unless something is done to address the border movement, which actually require complete closing down, complete shutdown. We appreciate that that is a function of the national government, but it's important for me to reiterate the urgency with which there is need to address that problem. And this goes the same way for our borders with Somali, our border with Uganda, and any other international borders. Seeing countries take decisive action in closing down or in shutdown or lockdowns have helped in a big way to flatten the COVID-19 curve.
I think the issue of borders, I did raise it. This is a responsibility of the national government, because there are protocols, how we deal with the neighbors, how we deal with foreign countries, and that is specifically a function of the national government. However, as you heard in my statement, is that we are urging that we need a COVID-19 protocol when dealing with the neighboring countries. And we are waiting for this, and I hope that we shall scale this particular issue that you have raised at the National Coordinating Committee.
Is a very, very key aspect of the fight against COVID-19. As you know very well, every county has put thermometers and checkpoints at all entry into their counties. And that is the initial time, but now we have agreed that they also put records of all the people in the vehicle, the registration number of the vehicle, the ID number, the name, the telephone number, so that should there be a case in that vehicle, then all those who have been in that vehicle could be traced. Secondly, should anybody appear with fever or any signs, the various signs and the case identification signs of COVID, then all the family members and the contacts and where he's been to are followed, and all counties have staff trained for that. In fact, there are vehicles that are set aside within the counties to make sure that all those contacts of that patient who has features of COVID can be also traced. The issue of crossing border, I think the chairman has mentioned, but that's actually a national government mandate. But counties have actually, for example, in Isiolo, we have now engaged university students. And just last week, I have flagged off 50 university students. And this week, tomorrow, Thursday, I'm setting off another 50 so that they now support in contact tracing. They support in awareness creation among the villages. They also assist in the quarantine and the isolation facilities. So contact tracing, therefore, is a very, very important component of attacking this disease. And I think it's happening very effectively both in Nairobi, Mombasa, and all the counties.
On the issue of allowances, you remember Machakos triggered it off, and it caused some murmurs. Of course, counties were responding to it in different ways. But we thought this is a critical issue that we have to look at it as Council of Governors so that we have uniformity in dealing with this particular issue of allowances. And I'm happy that the national government came in and the President directed the Ministry of Public Service, the Ministry of Health, and the Ministry of Finance, and the Ministry of Labor to sit together so that, plus the Council of Governors, so that they can come up with standardized allowances. This has already been completed. A particular standard allowance has been agreed. What is remaining now is actually how we are now going to implement this particular allowances payment to the health workers.